Today I am presenting two different surgical techniques of transnasal endoscopy congenital choanal atresia repair. Case 1 is a 13-year-old male complains of bilateral nasal discharge and obstruction. Diagnostic nasal endoscopy showing complete atresia of the choana, and NCCT nose and pain has revealed a mixed type of choanal atresia. Surgery we performed is transnasal endoscopy coblation assisted choanal atresia repair with bilateral crossover mucoperiosteal flap technique. This is the right nasal cavity showing complete choanal atresia. This is left side, starting with left side, infiltrating with local anesthesia, now giving inferior horizontal septal mucosal incision. Now the superior horizontal septal mucosal incision is joining both the incision by posterior vertical cut. After that, we are elevating the inferior based mucoperiosteal flap and retracted it laterally, coagulating the nasal mucosa over the atretic plate, penetrating the atretic plate in infromedial direction, and opening is created. This is the right side. We are giving inferior mucoperiosteal incision is giving, and superior incision is giving, and elevating superior based septonasal flap by giving an anterior vertical incision in the septum, penetrating the atretic plate. Now opening is created. Now we start the drilling. First drilling around the opening, then drilled out laterally and the posterior part of the septum, and then lateral drilling to widening the choana. This is the neochoana. Now we are applying mitomycin, soft cotton pledges, and mitomycin is applied over the cotton pledges also. Now we are covering the raw surface with the mucosal flap after rotating it. This is inferior based mucosal flap covering it. Now we are applying the fibrin glue over the mucosal edges. Now giving Surgicel over the mucosal flap. Now inserting the Foley's catheter and inflate. Moving to case 2, this is a 2-month-old infant. His NCCT head and PNS showing a bilateral choanal atresia mixed type. Surgery performed is endoscopic transnasal repair with puncture dilatation and drilling technique. This is the right side showing complete choanal atresia. First we are coagulating the nasal mucosa over the atretic plate. Then we are penetrating the plate in infromedial direction. Now opening has been created. With the help of the coblator, we are widening the opening. Same procedure is repeating in the left side, coagulating and penetrating the atretic plate in infromedial direction. Now we are going to give the septal incision on posterior part of septum, and mucoperiosteal flap is elevated and penetrating the posterior part of septum, and posterior septectomy has been done. Now drilling started on the atretic plate medially, laterally and remaining part of the bone, debriding the excessive nasal mucosa. Now we can see the neochoana. Applying mitomycin C and Foley's is inserted and inflating. Review of literature where choanal atresia repair with stent and flap, a systemic review article was found where they are telling that both the technique with stent and the flap technique are equally good. Then other one is efficacy of mitomycin.